All right, a couple more trauma responses. The first one that I want to talk about is sadness. Now, this may seem really obvious, but what happens a lot of times when people experience a lot of trauma or even some trauma is that your central nervous system or the sympathetic part of your nervous system increases and your heartbeat races. And it's kind of like what I talked about yesterday. You're living in this fight or flight mode, right? So what happens is when you get sad and then you start crying, it turns on your parasympathetic part of your nervous system, and it actually calms down your central nervous system to the point where you're able to then cope better with the extreme emotions of the trauma. So it's very common that people will go in and out of crying and then not crying and then being okay, feeling numb, and then going back into crying. So it's very common for those kinds of things to happen, but we just have to understand, and that's a very common trauma response. We just have to understand that that's what it is. The next one I'm going to talk about is guilt. Guilt is interesting because it's very closely related to one of the stages of grief, which is bargaining. So when you get to a point where you feel guilt about the trauma that you experienced, a lot of people, as they ruminate in their mind, sometimes they'll sit there and go, oh, I could have done this, or I should have done that. I could have been there for this person. I shouldn't have been there during this time. I shouldn't have, used those substances, because if I wouldn't have used those substances, then this bad thing wouldn't have happened, or whatever, right? So you get kind of into this bargaining phase of trying to cope and process the trauma that you've experienced. And even sometimes you get to a point where, and this is when it's really bad, is when the trauma response and what you're thinking about it is, I caused the trauma. Now, that one's really tough because most all of the time that's never the case, and that's never part of the reality. But in your mind, if you think you could have done something different to prevent it, then you're going to think that you caused it. And so at this point, after the trauma's already been experienced, and after, people get to a point where, they're trying to just cope with the trauma that happened, telling yourself that you caused the trauma, it just doesn't do any good. It gets to a point where it just doesn't, it's like beating yourself up after feeling guilt for what you've already done. So you're just beating yourself up more and more and more. And that kind of trauma response, it increases the trauma. It actually adds to the trauma. And you think the trauma's over, but when you're thinking that way, you're actually making the trauma worse, and you're creating more of it. It's really interesting, but it's not good for the person that's doing that. And so with the guilt, just like in that other video that I did about guilt, you just want, you get to the point where you already know what you would have wanted to change, and because it's in the past, you're bargaining about it. You're going through all these stages of grief, and then you just get to a point where you just accept, okay, yeah, I made this mistake or whatever. Or the hope is that if you really didn't do anything and there's no way you could have prevented something from happening, that you accept that that's the reality. You couldn't have done anything. There's nothing that could have changed for the situation to be different. And so that's what you got to come to, is that level of acceptance. So anyways, I could talk a long time about these two because they're so common. But let me know if you guys have experienced any of this type of, sadness in relation to the trauma, and then, of course, guilt in relation to the trauma. Thank you.